Hi, I'm Dr. Molly with Your Goals Physical Therapy. I wanted to talk to women out there that are noticing that when they look in the mirror, they can see that their knees are getting closer together. It's like their thighs are trying to touch in the middle and their feet are actually staying in the same space, the same distance apart. Now, is this just like an aesthetics thing? Like, does it really matter if your knees are getting closer together? It does. In fact, if you're having aches and pains and popping or clicking in your knee, it's probably directly related to the fact that your knees are starting to come in together and touch in the middle. Because this change puts a lot of stress on the outside of our legs and our knees, because our knees are not supposed to be that close, right? So you're getting one part of the joint that's getting stretched out and the other part that's getting compressed just from that change. And this is happening slowly over time, so a lot of people don't even notice it happens. And honestly, until it's too late and then they need a knee replacement. They just think that they have bad knees. So, they decided, hey, I'm 40. I know everybody says I'm supposed to go to the gym. So I'm gonna go to the gym, I'm gonna get a trainer, I'm gonna do all these right things. And the trainer asks you to do squats, or the trainer asks you to do lunges. And all you get out of that, especially if you're having this problem where your knees are starting to turn in, is a whole lot of knee pain. Going to the gym is miserable for you because it just hurts, and nobody's going to do anything that hurts. And in fact, for a lot of people that have this where their knees are starting to collapse in, it hurts to walk. So you're not liking to do any kind of physical activity, even if you really want to, because it just hurts so bad. And then you go to your doctor and the doctor just tells you, there's not really anything you can do. Nothing's wrong with your knees. Come back when it's bad enough and maybe we'll get you a knee replacement. And so if you're noticing this slow change, it's not in your head, and there are things that you can do for it. So let me talk about that. So the actual cause of why your knees would start to slowly get closer together is because something dynamically in your hip and your abdomen, so your stomach muscles, are not stabilizing where your leg bone is going. And so it's just sort of letting it collapse in. And that over time, again, because you're allowing your knee then to get compressed on one side and spaced on the other, over time that causes arthritis. And then that arthritis again leads to joint replacements. So the way to fix that is to address whatever it is that's going wrong in your hip strength, your abdomen strength, and maybe even your overall leg strength. Because you can't look at anybody like they're one joint injury. If I just looked at your knee, I would miss a whole bunch. There could even be something coming from your foot that's causing the problem. So that is what I help women do. If you are trying to get back to the gym or keep up with, your aerobics class, and you're noticing that your knees are aching and popping and clicking, and you just cannot tolerate squats and lunges and all of these really good for you activities because of the amount of pain that you suffer through afterwards, and you're noticing that your knees are starting to get closer together, come and see me. Let's talk. Let's find out specifically what is happening at your hip or your ankle, wherever it may be coming from, and fix it so that you can continue on doing all the things that you should be doing to take care of yourself without having to deal with the pain, because it shouldn't hurt. And there are things that you can do to help prevent it from getting worse and possibly to reverse it. Just depends on where we're starting this process off. So if you're having this as a specific problem and you would like to ask me about your situation in particular, feel free to contact me. I will leave my contact information in the comment section below. And until next time, I hope you're having a great day.